And we are recording with Dr. Alexander, who is graciously being patient with me. We got our times crossed, which happens probably every week on this podcast with a guest, and that seems to be the norm. You'd think I'd have that figured out and that smoothed out by now, but I don't. And my schedule's all messed up too, and I don't even have an excuse. I'm just being stupid. But please introduce yourself, man.
Hi. Thomas, thanks for having me on your show. Very grateful. Um, anyway, let me get straight to the point. My background, my training is in epidemiology, clinical epidemiology, research methods. I attended University of Toronto in Canada, Oxford in England, McMaster in Canada, in evidence-based medicine. And I did my doctoral work with Dr. Gayat at McMaster, Gordon Gayat. Reason why I mentioned his name is because he was one of the co-founders of the field of evidence-based medicine. That term, evidence-based policy, evidence-based economics, anything, it flowed from what work they did 30 to 40 years ago. He was my doctoral supervisor. I did a little certificate program in 2001 in Johns Hopkins in biological warfare. I was interested in that, in how to weaponize pathogen, not for nefarious means.
Well,
It's because back then they were. This actually was about 3 or 4 months before 9/11, to be honest. So
okay.
I actually did this program before that disastrous event happened. Um, there was a lot of talk about people trying to develop ways to put nuclear weapons in suitcases and miniaturize the nuclear attack to the battlefield, even battlefield nuclear weapons. I found that fascinating, and chemical weapons too for the battlefield. So I wanted to understand it. So I took my epidemiology background there, learned a lot. We used Baltimore, Maryland as tabletop exercise as to over the course of the program, how would you respond epidemiologically and from a public health? What are the medical issues you have to deal with in a city if a biological attack took place? I was fortunate to have Dr. Donald Henderson, who eradicated smallpox, if you've read about him, as one of the lecturers. And I spoke to him a lot over the time. I even asked him, we talked about him supervising me for PhD at Johns Hopkins in bioweapons and biological research. But I made a decision to go to McMaster under Dr. Guy. Dr. Henderson was a tremendous, tremendous force, very brilliant individual. Anyway, germane to this topic is the fact that I was working with WHO, Geneva, and Pan American Health from around the middle of 2019. I was helping them develop evidence-based training program for low and middle income countries in terms of how to conduct basic research and all of the issues around that. But around February of 2020, they reached out to me and told me that what is happening in Lombardy, Italy, Lombardy, and China, they are hearing about this COVID, this SARS coronavirus, and it was new to everyone at that point. And they didn't know what to make of it, and they wanted somebody to join their team to help them understand all of the information that was coming from across the world and to try and help them with their messaging to the world, WHO. So I was providing them their technical input for COVID pandemic response in the beginning. And whilst doing it, I got a reach out from people in Trump's White House for the same reason, saying that stuff that I had written and stated, they found very interesting. They reached into the Oval, into the White House, and the request was to see if I would join behind the scenes to provide some kind of technical input to the policy division, the communications division, and generally the administration. So I went to DC. It was a horrible, horrible time. I took some of my family with me. DC is one of the worst places to work and live if you've ever been.
Uh,
It was at the height of the lockdown. So when I arrived there, it was like a ghost town. The hotel we checked into, it was just crazy. It was just bizarre. And I had a lot of problems with the bureaucracy in DC in terms of once the bureaucracy figured out that I was working for the Trump administration because I was in the Health and Human Services building. they were kind of working against me, and in the sense of completing my hiring and paying me, and it was just terrible. The good news for me is I had a good boss, and some of the people I met, they were tremendous. I departed in September, and whilst there you have your run-ins with the media and with all of the different agencies. I did too. I I was persona non grata as well as other people like me, because it was felt that we worked with the Trump administration when actually my position was more scientific. Let me put it to you this way. If the Biden administration right now, though I don't support the philosophy or their policies. When I say support, I mean, I'm just one person, but it doesn't appeal to me, and some of them I find very suboptimal. Just look at the Afghanistan disaster.
Oh yeah.
That's an example. And one could argue and extrapolate that the public health response right now from the administration is probably similar to that catastrophe.
Sure.
But if Biden and the administration asked me to provide technical input, I would join the Joe Biden administration. If Obama had asked me in the past, it doesn't matter to me. This is not a Republican Democrat issue. This is coming to the table to provide technical input and helping. Yes. And I wanted to put that on the table. And no wonder, I think the press, particularly the media in DC, are probably some of the most despicable people on earth.
They're snakes. They're demons.
They're snakes. They're dirty
vipers. Yeah. They are what Andrew Jackson said about the bankers. You are a den of vipers, and by the force of God, I will rout you out. That's what they are. And but no, you said it correct. And I always bring that up on here. Man, like, you don't have, I'm with you. I'm not particularly a big fan of the Biden administration, but there is a certain point where you do have to look at things and go, hey, America is a plane, and the current administration is in the cockpit. Maybe we're not going the way you like. Maybe we're hitting turbulence, and maybe they're not serving the drinks you want. But to go, I hope they crash into a mountain, is insane. And you see that all the time, right? As soon as you're something pro-Trump, or you're even not pro-Trump, you're just working with them, they demonize you, be it ivermectin, hydroxychloroquine. I mean, we're reaching these levels of insanity, right? Pre-November 3rd, I wouldn't take a Trump vaccine. I don't want that dictator vaccine. Biden gets elected, everyone's like, take the vaccine.
Yes.
It's absolutely insane. I know this is kind of beyond the scope of what we're talking about, but
no, it's an important consideration, because you are seeing the issue. Like I'm against the vaccines for children.
Sure.
These vaccines, because there's no role for it. There's no medical basis for it. No one has prosecuted a case to show why a child who's at near zero risk of infection or even getting severely ill, why are they candidates for this? But now and again, I would have a Trump groupie who would come out of the woodwork and attack me and write me, and they would go nuts. We thought you like President. That have nothing to do with it. I mean, I'm looking at the science and I'm expressing my point of view. You don't need to agree with me. You don't need to go nuts. You know what I mean?
Hey, man,
so it's crazy.
I'm with you. I like Trump. I openly talk about it. I like him. I hate that he's like pushing the vaccine on everyone. It's okay to differentiate things. It's okay to go, I don't agree with that. I like Trump. Trump also sold $10 billion of weapons to the Saudis. I wasn't a big fan of that. And it's okay to disagree with things. What you said about, I just have to add this note, studying biological or pathogens as weapons. I smiled because I've had on here 7 times now Dr. Ken Alabek, head of the Soviet Union's biopreparat, he was the first deputy director of their biological weapons program. He defected here in 1992. And he talks about it all the time. And he didn't want to do it. He was conscripted to do it. And then he fled the Soviet Union, and now he's working on autism. But no, so when you were like, I didn't want to build nefarious means, I'm like, no, I get it. I've actually talked to a guy who didn't want to do it either. But it is something that you have to study in the field of weapons.
Well, I mean, Thomas, let me put it to you this way, because I mean, already we're into the interview. You haven't even posed any questions, but a lot of interesting things has come out. And let's just talk about this quickly.
Okay.
You'll be foolish, or you'll be nonsensical in the world, in America, to think, oh my God, China is doing bioweapons research on pathogens and this. Listen, every country in the world has to do it.
Yeah.
We have to do it.
Yeah.
We will be reckless and dangerous if we weren't studying pathogen, because we want to know that if you put it on our battlefield or if you put it into our cities, we know how to deal with it. So we need to experiment with it. The question is, are there nefarious people involved who are you doing this in a nefarious manner that could harm the United States? And that's where we are right now. It's no question that they were monkeying around. They have this affinity, this love for coronaviruses because it's something they could fool around with in the lab. Everybody knows that. It's been going on a long time. The question is, what did they do? Were bad people in different labs around the world working on this in a way to juice it up and gin it up to attack America? That's a very, very important point. And the question of was this a biological attack? That's an important question. That should not be discounted. Was this a low-grade biological attack? Were people deliberately infected and came to America?
Dr. Alexander.
And we need a proper investigation of who was involved. Many people are talking about the seeds of this were in the United States. That raises a very, very important question. Would there be people in America at high levels who would engage in this kind of dangerous research with the intent of harming America at some point? So to say that people are conspiracy theorists and stuff, no, listen, we live in the United States is the greatest nation on earth. Yet at some point, an American president was assassinated. Well, two, but let's say the one in our lifetime that we know about. So very bad things happen. Bad people do very bad things, and you must never stop trying to find out why, who did it, for what reason, so it could never happen again. And I think this pandemic response, this situation that we're in, there seems to be a lot of poison pills with regard to this pathogen. And there's a lot of discussion over gain of function this, gain of function that, Wuhan lab, Fort Detrick, North Carolina Chapel, these different names getting played around with. I mean, if these are central to a discussion, we need to have this discussion and we need to have a proper investigation to find out who did it. And regardless of where it goes and who's involved, they need to be held accountable.
You know, that's actually a beautiful analogy, because a minute ago you said we're 10 minutes in the interview and you haven't asked me a question. And well, my logic with these podcasts is I take them on the route that they feel like they're going, and we let them go where they go, regardless of the outcome. And here we are talking about this, and it's very important because Brigadier General Robert Spalding, former one-star general, piloted B-2 Spirits, was in the Obama National Security Council. He was sacked because he raised the alarms on 5G and the China's Belt and Road Initiative. I had him on here, episode 161, and he wrote the book Stealth War, How China is Waging a War with the Help of the Elites of the United States. And he talks about unrestricted warfare. That thesis put forward by two Chinese generals or PhDs in the late 90s about, hey, we can't take on the United States face to face. We know we can't. They have too many weapons, which echoes what Shiro Ishii said, the head of Japan's Unit 731, which I'm sure you're aware of, in World War II. America is a machine society. They can build more tanks and planes and ships faster than we can, but what takes them 18 years is to regrow a soldier. So if we attack those, which they were doing. And so there is a huge question when people say, why does it matter where it came from if it came out of a lab? Listen, if there's an EMP above New York and all the power goes out, it's bad. But does it matter if it came from the sun or from a Russian EMP weapon? There's a very big distinction there, all right? Yes. So if JFK's head got shot by a Secret Service agent by accident or by a Russian assassin, there's a big distinction. So if the coronavirus came out of a lab as a form of asymmetric warfare to do $10 trillion of damage to the United States, to remove a sitting president, and to usher in a world where all the supply lines from the globe going back to China, everyone feels the power of that. There's a very big distinction between whether it came from a bat having sex with a pangolin or from a lab in Wuhan. One is, hey, that's the way the cookie crumbles. The other is an act of war. So what you're saying is very very important. It doesn't matter where the end takes us. We have to follow that question, no matter how unhappy or uncomfortable it is. We have to, because if we
Yes.
don't, they're going to get more ballsy, and they're going to do it again, and they're going to do it with something like Ebola, and it's going to be
Yeah.
insane.
Well, you're absolutely right, and I realize how very versed you're on the topic. The reality about it is this. You need three basic ingredients to start. You need capability, you need intent, and you need vulnerability. This is from a basic point of view. If you want to wage a biological or chemical attack, or even a nuclear attack on a nation. So look at the United States. Would you say that there are bad actors out there who had the capacity to develop some kind of biological weapon? Well, I could say if I step back and look at everything that we know now, even if I don't bring my biological warfare, some expertise I have, and I just talk from a lay person's point of view, from what is already there in the public space. Yeah, there are people out there. China has the capacity. They have that capacity in Wuhan lab. They've shown that. Would they have the intent? I'm not going on record saying they did this deliberately. But could they have the intent? There are many bad actors out there that if they could wage war on America, they would like to take the shot. So there are people who have the intent. Was there vulnerability? Yeah, United States was vulnerable. And so the reality is, though, that this has shown us too how dangerous this world of pathogen is, and how you could technically take people, infect them, and send them out into the world. You don't need a ballistic missile anymore. You don't need to deliver a system. So it's a very dark world with technology and science and bad people involved. You could do a lot of very bad things. And that's why we need to find out who did what here, who was actually involved, and was this really a bad thing? Because if it was, that was an act of war.
Yeah.
Somebody. And we need to deal with it. We can't let that go.
Yeah.
And so I think this is an investigation that must take place. And there are many things I could discuss, and I don't think we could discuss it on this show. But the reality about it is that we're in a situation right now. The more important thing to us right now is to get through this particular thing. They started 19 months ago with give us 2 weeks to bend the curve. Okay, they said that we need 2 weeks because we could quickly ramp up the hospitals and get that in order so that we could treat any incoming people with COVID, or as well as offer support to the non-COVID illnesses. Well, that's 19 months ago. That was the responsibility of the government and the respective public health systems and hospitals in the states, in the locations, the cities, wherever. We did our part. We gave them 2 weeks, that became a month, that became 45 days, that became 3 months, that became 6 months. Now we're 19 months in. We, the people across the world, have bore the brunt of this madness. They have done nothing to fix it, nothing. Because for them to ask for more restrictions today and for more masking and more lockdowns and more this and more that, it means that these governments, United States included, have failed. They failed. Disastrously, they failed. You know, and they failed the people and they caused a lot of deaths. I mean, simply, just look at the area of early outpatient drug treatment. I'll tell you, let me try and help you drive this conversation. There are about 6 things that doomed and hobbled the pandemic. First of all, I don't think this was a pandemic. I never felt this was an emergency. There was an issue, but we did not need to do what we did here. This was outrageous what the governments did, this entire US task force. When Trump discussed that, Fauci and Birx came into his office and told him, Mr. President, we have to shut it down, and he goes through this spiel and stuff. Yeah, it was because of them that Trump shut the country down. It was their policies, not Trump. They were guiding him. He is the CEO, like of a company, and you assemble the team around you who will give you the guidance for your decision making. So when they went on CNN recently and they told Sanjay Gupta, they blamed Trump for the deaths and they blamed Scott Atlas and stuff. I mean, I jumped out of my seat because I was there partly. And I knew that was an absolute lie with Fauci and Birx, and they went on and on and on. It was their policies that Trump enacted. Trump followed them and locked the society down. Trump closed schools. He followed their guidance. It was their failed policies that have the country, that put the country in the situation that it found itself in. Many, many people died. Many people died because of those policies. Those policies sit squarely on Birx and Fauci. They ran that lockdown, school closure, mask mandate, insanity. And I wanted to say it this way. I could couch the discussion where there are about 5 or 6 key aspects of this that doomed and failed this response. Remember, the United States leads the world. So everybody followed the lockdowns as soon as America locked down. Everybody followed the mask crap as soon as America did the masks, etc., and closed schools. So the rest of the world, even if you didn't understand it yet, is looking at what America does next. And if we continue this lockdown BS and this vaccine madness, the rest of the world is doing it because America is doing it. So the key issue from day one when Fauci and they came and implied to the public and the world that we are all at equal risk of severe outcome if infected. That was an absolute lie. And it was that lie that hobbled the United States and doomed it to failure in the response. That damaged the response because they made everybody in the public feel that regardless of your risk, you all have equal outcome of severity and mortality. That was a lie because we knew from the data that COVID was amenable to risk stratification. And if you adopted an age risk stratified approach to managing it, to mitigation steps, to anything, that you could target the high-risk people and focus on them. You can't apply a carte blanche approach because not everyone, 99% of the population were not at the same risk of a small 1%. So you should not have done what was done here. But that lie was needed to sear into the minds of the public, to have 15-year-old Johnny, who is at the perfect prime of his life, very healthy, scared and will not come outside still today because he thinks he's at the same risk of mortality as his 90-year-old grandmother with 4 grave underlying medical conditions. Johnny is not at risk, but he was told this for so long, so repeatedly by the CDC and the NIH and the FDA and all these high-level people that he can't get it out of his mind. That was the first strategy they used to create this insanity. The second was this issue of asymptomatic spread. Asymptomatic spread is very rare. We've not been able to prove that conclusively in this situation. I can't find the research, any published research to verify this asymptomatic spread. Even Fauci in the beginning in March was on a YouTube, was on a video when he came to the podium to say asymptomatic spread is not the driver in a pandemic, it's symptomatic spread. And just the term should tell you intuitively and common sense. If you are, pathogen spreads by making you symptomatic, by your symptoms of sneezing, coughing, runny nose, whatever, you are spreading it then. It will not spread asymptomatically. So this was a lie, which is a complete lie. And because of that lie, so they had you feeling we are all at equal risk. So you start to get messed with your head right away. So everybody's scared. Then they tell you, and by the way, there's asymptomatic spread. So you mightn't even be feeling anything. You might think you're fine, but you might actually have it and spreading it. And people messed up in their heads believing that crap.
Yeah.
You know what I mean? And they're telling you, well, you know, the best thing to do, society, you know, you're good governance society, you're a civil person, you should be caring about your neighbors and your family and all these people. So just think of yourself, everybody running around as asymptomatic and you're spreading this thing. So now everybody thinking, well, I have this thing and I'm spreading it. So then they jump on you and they put on you, so we need a mask for that. So drop the mask on you. That was the third. Okay, so this asymptomatic drama, put on a mask to deal with it. When today we look at all of the evidence, the masks, the blue mask, the white mask, totally garbage and junk, ineffective, never worked. Day one, still don't work today. Masking children, utter junk and corrupted science, none of it is actually child abuse. It's criminal to put a child in a mask. So first one was the issue of equal risk. We went through that. Second one was the lie about asymptomatic spread. Bull BS. Third lie, this issue of recurrent infection. They started, Fauci came to the podium. Well, you know, if you got infected, you could be reinfected. BS. We can find one case, one, in the entire world after 19 months. All the science we look at, we can find one verified, bona fide case of somebody who got infected with this thing and got COVID, that they got reinfected with a proper, I'm talking about PCR test, antigen test with genome sequencing, with symptoms. So, you know, this person really had this thing. And then this person got it again, and we want 90 days apart. We can find no instance, none. I challenge anybody to provide one case of the hundreds of millions where somebody got infected twice. That was the third lie, the doomed this response. Fourth lie, the use of this RT-PCR test, complete garbage. It was never a diagnostic test. The test, we knew from looking at the data very early on that when you go more than 20 cycles, you're going to be detecting viral junk, debris, past coronavirus, common cold coronavirus. You might even have been recovered from this coronavirus, but it does not denote that you have present active infection. The PCR test, together with the concept of asymptomatic spread, were two of these issues that were used to really screw the nation up and drive this fraudulent thing in front of us, because they were telling you that you are spreading something asymptomatically. Don't even forget the fact that you're feeling fine. You just ran 15 miles and you're in perfect health. You have no symptoms, but you actually have it. You just don't know, and you're spreading it. So make sure you have your mask on. And we're telling you have it because we're running this flawed 97% false positive PCR test on you. And we're telling you you're positive. I want to know what the hell going on. I feeling fine, you know what I mean? But you're positive. You know, the test said you're positive. You know?
Oh, yeah. Oh, yeah.
No, it's madness, because we knew at 20 cycles, that's a cutoff. After that, the test is showing major false positive. By the time you hit 30, a cycle count of 30, we had 95% false. You hit 35, we had 97. You hit a 40 cycle count threshold to denote positivity. That's 100% false positive. Go to the CDC documents. The CDC dictated that you use a 40 cycle count. Mostly all these positive tests, you saw CNN and they were running breaking news, 10,000 positive cases today. Those were 99% false positive. Nobody had anything. But you're feeding Johnny. Johnny at 50 now, he went below his mother's bed because he's scared now, because he's seeing, you told me that I'm at equal risk of granny at 90. So I had to hide. You tell me I'm spreading asymptomatic. Now you're telling me I'm positive where I wasn't even feeling sick. So this is a disaster. With Johnny not coming out, period. Johnny is going to stay there for the rest of his life now. That was the fourth, this PCR test. They used that.
That was fifth. Fifth, yes.
The next lie was the issue that we had no treatments. That was such a lie, because from day one, we figured out that this this pathogen, this was probably the most treatable respiratory virus, and that this pathogen responded to a sequence combined approach using proven already existing antivirals. And because the key is to get in there in the first 2 weeks when the virus is replicating. When you get exposed, and let's say you get infected, there's a 2-week period where the virus replicates, reproduces itself, and it peaks around the 7th to 8th day of replication and then starts to come down. By around the 10th to 12th to 14th day, bioreplication is done. If you're infected, you're infected. And at that point, if it got hold of you, then you're going into the respiratory hyperinflammatory stage, that stage where the acute respiratory distress syndrome, florid pneumonia, we would say, ARDS, where the cytokine storm, where you develop the breathing difficulty, that point. So, and then post that, if you degenerate, if you really got ill, and we are talking about the elderly here, or somebody with multiple comorbid conditions, or a very morbidly obese individual, 300-400 pounds, because we've found that obesity is a superloaded risk factor second to age. In fact, obesity is so potent that if you are young, if you are 20 and weighing 400 pounds and got infected with COVID legitimately, you're going to have a problem, because we found out physiologically and at a cellular level that the receptor, the ACE2 receptor that the virus uses to infect the cell, it's expressed at higher numbers in the adipose tissue, fat tissue. So it's expressed heavily in the ovaries in women, testes in males, the endometrial surface is expressed also very heavily in adipose fat tissue. So we then understood why 80 to 90% of people who were dying in like New York and across America, they were very overweight and obese. Most of the people who died, if you take age out of the picture, out of the equation, and let age fall to the side, what you're left with is obesity. Obesity is probably the strongest predictor outside of age. And we saw it. Many of the nurses who died, the frontline people, they were morbidly obese. And I think COVID really showed that the American population is very unhealthy.
Yeah.
The British population, the Canadian population. This COVID exploits your risk, this virus.
Yeah.
This virus on its own, if you are a healthy person, there's nothing. If this virus moved into a population where everybody was 40 years old, roughly, everybody was proper weight, no underlying conditions, the only thing would happen is you might be infected. You would never know. You would have no sickness. You wouldn't die. COVID exploits risk factors, and the extent of the morbidity and the mortality in society is dependent on how unhealthy the society is. And it revealed that Britain, Canada, the United States are very unhealthy societies, a lot of very overweight people. But that was a taboo topic. Nobody couldn't say that.
Nobody can talk about that. Nobody can bring it up. Nobody can bring it up.
We can't say it, but we're saying it here.
Yeah. Oh yeah. No, you know, you have to go give the vaccine to a 10-year-old and everyone's clapping. And then you're like, you might want to stop eating. And they're like, you shut up right now. I am beautiful. And I'm like, I didn't say you weren't, but you might die. And it's how dare you, which just shows this whole thing is, sorry to cut you off. Keep going.
No. I just want to get the points on the table as to why we got here. And I mean, the fact of the matter is that we had this early treatment with ivermectin, hydroxychloroquine. Hydroxychloroquine proved very, very successful in this regard. We have other antivirals, favipiravir, colchicine, quercetin, etc. They work in different ways, but they generally are in the viral replication phase, meant to stop the viral replication. So the virus doesn't reproduce in you, and you don't go further to the pulmonary, more severe phase, and really to the end phase, which is end stage COVID in people who die. And that is the blood clotting phase. Because what we also found out as time has gone by is that COVID is not necessarily a respiratory disorder. COVID is a vascular illness. Mm-hmm. And what kills you when your lungs shut down is not that there's virus in your lungs, it's because there's blood clots in your lungs, very microthrombi that accumulates throughout your body, but in your lung. And that causes all of the blood clots, causes the problems with the exchange of gas, the oxygen and the carbon dioxide moving across, and all of the inflammation, etc. So we understand today, COVID September 2021 is very different than COVID February 2020. We know specifically who's at risk, and we know ideally how to treat it, how to manage it. We know early treatment drops the risk of hospitalization and death by 85 to 90%. So that was the sixth catastrophic failure in life, because it prevented governments and doctors and stuff did not treat patients properly, and many people died. Dr. Zelenko, Dr. McCullough, they are arguing that of the 650,000 Americans who, let's say, died of this issue, we could have had 550,000 still with us had they been given early treatment. And we also figured out that COVID is more institutional illness, in the sense that the vast majority of deaths occurred in institutional settings like nursing homes, etc. But the point though is, sadly, it was the elderly who, it was like killing fields in our nursing homes, because the staff was bringing in infection. And that went on too long. We kept lobbying the governments, stop the staff from entering, use models where the staff can't leave for 2 weeks at a time, 1 month, and pay them extra, pay them handily for it, let them stay. Because it's when they went home and they came back the next day, they were bringing the pathogen back into the nursing home, and they were causing all of the outbreaks. So the governments, the agencies responsible for the operations of these, regulating these nursing homes and long-term facilities and assisted, they failed. The death's on their hands. It's on their hands, because they knew. We kept saying, so between the nursing lobby and the corruption and stuff, we contributed a lot, these agencies and these leaders, to the deaths. And the reality about it is, these are the facts and these are the things that really messed this pandemic response on. And it moves quickly from being a public health matter to a political matter. Because, for example, look in the beginning, in the first couple of months, you had Trump there on the podium trying to get the task force settled down and directed. You have WHO in February, March saying, China saying no human-to-human transmission. Then you had WHO come out right after saying, we agree with China, no human-to-human transmission. Then you had Fauci went on 2 or 3 talk shows quickly saying similar. And Americans don't need to worry about this, no problem. So you had WHO, China, and Fauci working against Trump. And you need, when you look back at things, you need really to give Trump some credit, a lot of credit, because to go against those 3, and that's a powerful trifecta, because that they were putting their information and their message into the public space to try and guide Trump against the border closure and all of these things. And he really cut against the grain by closing the border, because he was fighting against Fauci, China, and WHO. And they were all lying. That's the point. They were lying. They were giving the world and the public and the Americans false, incorrect information. So the seventh thing that the public needs to also know is that very early on in the response, CDC took upon itself that they were going to do the test. They were going to invent the test and create the diagnostic test. And everybody was stand down until CDC creates this test and shop it out to you, and you validate it quickly, and then that's going to be the test. Well, it turns out that when CDC sent it out to the labs, etc., the test had a catastrophic failure, and it was contaminated. And for a 4 to 5 week period at the beginning, whilst all other nations was beginning to test crazily, you were hearing every day the task force was talking about testing, getting testing. At that point, what was not explained to the public was that the nation was flying blind. It flew blind for 5 weeks. Even Trump knew, because the CDC had failed. They couldn't tell the public the catastrophic failure. It would have panicked everyone. So between the CDC and the FDA, we're trying to figure out how this thing failed. And when they did, then the commercial labs and the laboratories were given the green light to produce tests quick. And they produced like hundreds of different tests, that many of them suboptimal even, but we had to get tests out there. The CDC test was a catastrophic failure. And during those 5 weeks, the virus seeded across the eastern coast of the United States and the western coast and spread across America. Where we are today with virus still, this pandemic, the shape, the confluence of the pandemic is in large part due to that 5-week failure. There was 5 weeks that we didn't know where the virus was, how it was spreading, and that sits directly in the lack of CDC. It's so much of a failure that Dr. Redfield, who was the prior director, he appeared on a show recently on CNN with Sanjay Gupta, and he told Gupta, and I was actually surprised because I knew about it because I was in the administration for a period, small period, but when he said it, I was surprised that he was so honest, and I give him a lot of credit. He said, you know, the nation flew blind for about 5 weeks that really set back the response. I am arguing from an epidemiologist point of view, we are still digging out of that hole. CDC, that failed 5 weeks, doomed the response. We're still digging out. And someone like Admiral Girard, who kind of headed the testing here, I give him a lot of credit. I met him there. We had meetings. I spoke to him. He's a very smart guy. He was in the military at some point. But he was dealing with a failure because it was him who was trying to spearhead the digging out from the failure of CDC. So the testing that went on post that 5 weeks, we have to give him a lot of credit for at least getting us out of that hole, because that was it was like a fatal flaw that you can't recover from. So I give Admiral Girard a lot of credit, because he was in a highly political, very damaged situation, because ordinarily you can't recover from that. So these are the 6, 7 things that really hurt us, particularly by not allowing the public access to early treatment. You know, so between the lie about asymptomatic spread that had you believing all this crap, the lie about these the recurrent infections, well, you know, if I get infected, I could get reinfected, so I need everything. When you look at it now in entirety, you lay it out, you can see from the beginning, the scaring you about everybody's at risk and you must lock down, etc. Everything really was for these vaccines, because now we will hold your freedom and dangle it to you. We will not lock down anymore and you come back to normal if you take these vaccines. And now we know they've failed.
Yeah.
Vaccines have failed. It's a catastrophic failure. I have actually been on record. I've said it. I was on Fox. I've been on different interviews with Stu Peters, Alex Jones' show. I said it. I said, I would like President Trump to come to the table today and say, for sure, vaccines not for kids. He needs to do that.
Yeah.
He needs to at least button this up with that, because there's so much problems with the vaccines right now in terms of adverse events and death, that if he at least does that, it will lend a lot of credit. Because I know from my touch with the administration and my meetings there at the White House, this is a good guy. This person we're talking about, President Trump, he cares about America. He really did. I joined the administration. I accepted because, well, who wouldn't if an administration asked you to serve?
Sure.
Who wouldn't? You'd be a fool, even if you don't even agree with their politics. But I accepted readily because I'm an immigrant originally from the islands, etc. And I really appreciated a lot of the things he was doing for the economy and for the minorities, for women and stuff, and the jobs and the economic empowerment zones and all of these things. Those things were they had a potent, I had many friends, colored Americans, who were telling me, Paul, for the first time, I could go and join a job line in one place, and down the street, I could say, to hell with this one. I'd go down and join another job. I couldn't do that before.
Yeah.
I had choice now. So Trump really did a lot of good, great things for nations. And I argued with people too. that I could see if things played out the way it was looking January 2019, for sure he'd be a good candidate for Mount Rushmore. And I wasn't kidding.
Another,
Because
I'm unapologetically pro-Trump. I love Trump, and
yeah,
it's yeah, and
right,
I'm with you. I think he's fan. I have a lot of friends that hate him, and to me that's and I hate this term, but to me that's the definition of white privilege. I'm like, the fact that you have the luxury of hating a president because he says mean things, and then I look at my friends who are immigrants from Kosovo, from Bulgaria, and they're like, Trump 2020, they love him, and I'm like, these are the guys that are for him because they understand what it's about. But as we said earlier, it's also okay to disagree with us and not like him. But you're right. I mean, if he wants to maintain any sort of, I think, credibility, if he came out and said these vaccines aren't for everyone, they're not
correct.
for everyone. Dr. Malone came on my podcast and said that. And I was permanently banned from YouTube for interviewing
Oh,
Dr. Malone and Dr. McCullough. And it's,
okay.
and to me, and I can keep going forever, but I want to remind you, you said you had to go.
Yeah, no, but
So sorry, go on.
no, you talk.
No, okay. So we'll do a part two, definitely.
No,
But
we definitely gonna have to do a part two.
yes. But to kind of wrap up everything you were saying about those 6 steps of failure, it all leads to the Emergency Youth Authorization Act.
Yes.
And my argument about this could be cut down very simply if someone just said, what do you mean? You're allowed to take the vaccine or you're allowed to take ivermectin? The fact that there is a coordinated effort across every global big tech platform to shut down and ban. It's one thing if you ban me, I'm an idiot screaming at a camera, sure. When you ban Dr. Peter McCullough, when you ban Dr. Robert Malone coming on my podcast talking about, Dr. Malone came on here and said, hey, if you're under 50, you probably don't need it. If you're over 50, you probably do need it. Dr. McCullough came on here, the most published cardiorenal physician in the world, and said, hey, take quercetin, turmeric, vitamin D, and zinc. That's the episode I got banned for. When these things come out, when Dr. Mobeen Saeed comes on here and talks about ivermectin, when Joe Rogan says, hey, I took ivermectin, I got better in 3 days, and then CNN says Joe Rogan's taking horse dewormer. When you see all of this, you cannot argue against the fact that there is a coordinated effort to reduce, remove, and suppress all alternative treatments of one, generic non-profitable drugs, but also alternative treatments which would nix and void and remove the Emergency Youth Authorization Act, which itself would then remove the lack of liability from big pharma to be sued by a vaccine that to date, September 9th, Thursday, 2021 at 11:53 a.m., there is, off the top of my head, 13,911 deaths between February of 2021 and today. 13,911 deaths between 1990 and 2020, 30 years across 70 vaccines. 30 times 70, there was 8,000 deaths. We are coming up on double that in 1/30th of the time. And that's just on the VAERS system. That's what's reported. It all comes down to one thing. They're making money hand over fist. And the people that, it's one thing if you push a mask and you don't need a mask and it's all right, whatever, screw that guy. It's one thing if you make everyone scared. Hey, everyone's always scared right after 9/11, right? Yellow alert, orange alert. Yeah, sure. Okay. When there's a coordinated effort to suppress alternative treatments that, as Dr. McCullough said, and as you cited, could reduce the 650,000 deaths by 85%. You're moving from, oh, that guy's a bad politician. You're very closely and acceleratingly, that's not a word, in an accelerated manner coming towards crimes against humanity.
Yes.
That's what you're doing now. You're coming up on, this is no longer, you can't run for re-election. This is the stuff that laid out the Nuremberg trials. This is what led to men being hung. This is what led to the Mossad going into South America and capturing Eichmann and bringing him back and putting him in a glass box and putting him on trial. We're coming to that. And the only way we're going to get to that faster is if individuals like yourself and other doctors talk out about it. Screw big tech. It doesn't matter if they want to ban us. We're going to keep talking. So long as I'm alive and have a camera and have a flag, I'm going to keep screaming like a psychopath until the truth comes out, because it's absolutely disgusting.
Yes.
I get very excited, if you can't tell, and I get jacked up, and I have to let you go because I can keep talking, but you said you got to go, so I'll let you go.
But you know, I talked, and we have to have a second and even a third show.
We need
bottom
10.
line,
We need
bottom
10.
line here, Thomas, is that the bottom line here is that if you was to say, Paul, we on a bus, we come into a stop, you have 1 minute. Give me your overall gestalt 50,000-foot view
Yeah.
of what has happened in the
Yeah.
last 90 months. I tell it you this way. I'll say no pandemic. This was a new a virus. We're not even sure what it is. It was coming into a virgin population. So it looked like people were getting ill. But this was no pandemic. The reaction to it was not necessary. It was devastating, because when I looked, and not just me, as a team of us scientists work together, because we work with Dr. McCullough, Dr. Risch. We do this daily. We are part of a research group. When the team that was assigned, we looked at lockdowns. We looked at all of the lockdowns that have taken place since the beginning of this situation. And we looked across the world of every setting, every location, everywhere in the United States, any country. We found not one instance, not one time did any of these lockdowns work to curb the transmission or reduce that. We similarly looked at the school closures. We found no instance where school closures work to reduce transmission or any positive effects. We looked at the mask mandates. Every state in America that employed a mandate, every country, we found not one instance where the mandates reduce transmission or reduce death. We've looked at everything. We've looked at all of the policies, and the policies all failed. All of these restrictive COVID policies were devastating. They resulted in crushing harms. What we did was we shifted the burden from the more affluent to the poorer in societies who could not afford to remote work, etc. And a lot of poor children. Listen, let me just end by saying, we were seeing data that was coming up from the different states that was showing us clearly that, and the media was not reporting, because remember, they were entering the election cycle in election year. So if you reported this information, then you would be helping Trump, because he was fighting this task force daily to open schools. He was fighting them, because what was he seeing? We were getting reports of business owners across America committing suicide.
Yeah.
We were seeing employees who were laid off on furloughed committing suicide. And we were seeing little children, young children in America, 300-400% self-harming, suicide hotlines, opioid overdoses, but we were seeing them committing suicide, actually committing suicide. It was a very shocking thing. We looked at, there was a survey that we did. We found that in June to July of 2020, we looked at all of the college and university age students across America, ages 18 to 24. So the youngest, the healthiest, like you, the best in the society. And we surveyed them. What did they report? There was one question that stunned when we looked at the analysis. About 25 to 30% of persons in America, 18 to 24 years old, reported they seriously considered in the last month suicide.
Yeah.
And that shocked us. Yeah. And they reported it was not due to this virus bull. It was due to the lockdowns. It was due to the erosion of their rights and the respective states imposing all these restrictions and masking this and craziness. That shocked us. We see 30% of the healthiest people said they had suicidal thoughts. They couldn't go anymore with it. And that's why you saw Trump on the stage, the podium every day. We thought it was a clown car show at a certain point, because he would be there with Fauci there on the stage and he's arguing with them, and they're going on the news after him and saying opposite to what he wanted. It was insane, but he was literally fighting that task force. And had it not been for Scott Atlas, we'd have been in greater danger. Scott Atlas actually brought some sense and sensibility and maturity to that task force, and they hated him. Fauci and Birx hated Atlas. They said so on CNN. So Atlas walked into the wall. I knew him. We had meetings in the Eisenhower building, in the White House. This is a brilliant guy, and he understood what I understood, and our approach was you have to have a more balanced approach. You have to calibrate the policy. You can't just lock down and then leave the lockdown and harden the lockdown, and it's killing people and you're not changing your policy. You have to consider the harms of your policy, not just your model possible benefits of it. You have to also model in the harms. And if you are seeing that the harms are crushing, you need to stop that policy. And that's why he was vilified and attacked, because he was saying, you people are crazy. You are killing Americans with these school closures and these lockdowns. So Scott Atlas, I know him personally, needs to be commended, I have to say. So anyway, I know we run out of time too, and we have to do this again.
Yeah, and I can talk forever, but I know your schedule is busy. One, real quick, I do need you to get as many as your physician friends or interesting people to come on this podcast as you can, because the bigger and bigger guests I have on here, the more traction I can get. And I think you would agree. I'm just trying to find the truth. I try to stay in the middle of the line. The second thing, and I want to wrap it up on this, as you talked about, going back to the beginning of the conversation, is that if you don't investigate these weapons, then you're putting yourself at risk. I mean, that goes back to the hydrogen bomb, right? 1,000 times stronger than the atomic bomb. When the physicists came into the White House, Truman asked, can the Russians or can the Soviets do it? And they said only a matter of time. He said, we have to do it. And then second of all, go back 7 years from 1952 to the hydrogen bomb, Ivy Mike, back to 1945 with the atomic bomb, when Leslie Groves, the head of the Manhattan Project, was talking to Truman, and Truman wasn't sure whether or not he was going to drop it on mainland Japan and offset a mainland invasion, which would have killed 1 million American Marines, including my dad's dad. I wouldn't be here. Leslie Groves, I believe it was Leslie Groves, said to Truman, if you are not going to drop this bomb, you had better start preparing your impeachment speech, because when the war is over and the American people find out that the war could have ended with 1 million less deaths if you had dropped this bomb and you didn't, you will be impeached or you will be hung. And to me, right now, there's got to be someone at the higher ups who are going, if the American people find out that 85% of these deaths could have been avoided with generic medications that have decades of research and use behind them in every age group and pregnancy and everyone,
and cheap,
and then not only that, you actively suppressed it. We're in for a wild ride. I kept you 10 minutes longer than I said I would. I loved it, man. I had a blast. Dr. Alexander, thank you so much, sir. I will send you an email. We'll set up part 2. I'm excited. God bless America. Thank you, sir.
Thank you.
Take care.